Is your low mood or depression caused by a physical health problem? Many people don't suspect that a medical issue like thyroid dysfunction, anemia, or even sleep apnea could be silently fueling or causing their mental health difficulty. Today, I'm here to help you think about a few common physical causes that might be at the root of or contributing to your emotional struggles. Welcome back to another episode of The Health Perspective, where we look beyond the surface and dive into the factors that shape our mental and physical well-being. I'm Dr. Daniel Gordon, a GP, and my mission is to help people truly explore the underlying factors which affect their health. So when I see someone with low mood or depression as a doctor, I'm always thinking about physical factors that may be contributing to their presentation. And it's not uncommon as a GP that I would see a patient with an underlying medical condition contributing to, or sometimes even causing, emotional distress. So this video will outline some of the most common conditions that I encounter where extra care needs to be taken around that physical and mental health crossover. So let's get started. Number 1, hypothyroidism. This happens when the thyroid gland located in the neck doesn't produce enough hormones. Thyroid hormones help regulate our metabolism and energy levels. Decreased thyroid function doesn't only affect mood, it can trigger fatigue, weight gain, and general lethargy. Some other symptoms of thyroid problems include feeling intolerant to cold, having dry skin, struggling with constipation, or menstrual cycle changes. Number 2, anemia. Anemia is a condition in which you lack sufficiently healthy red blood cells to carry oxygen to your tissues. Now, there are many different types of anemia, but it's commonly caused by deficiencies in iron or certain vitamins. Why does anemia affect our mood? Well, low oxygen can leave you feeling constantly tired, weak, and short of breath, which can make you feel physically unwell and can worsen depressive feelings. The key symptoms to look out for are severe fatigue, feeling short of breath, especially when you exert yourself, feeling that your heartbeat is faster than usual, and even people commenting that you look more pale than usual. Number 3, menopause. As women approach menopause, fluctuating hormone levels can create a host of physical and emotional symptoms. These hormone fluctuations can lead to irritability, anxiety, and low mood. In addition, some women can struggle with lack of sleep from the physical symptoms of menopause, such as hot flushes or night sweats, and this lack of sleep can further compound mood issues. Number 4, sleep apnea. This is a condition where you repeatedly stop breathing during sleep and is often poorly understood and underdiagnosed. It's often associated with snoring and typically occurs in people who are carrying excess body weight or excess fat around the head and neck area. The key with sleep apnea is it disrupts restful sleep. So even though you may feel that you've slept through the night, the quality of your sleep can be extremely poor. This chronic sleep deprivation leads to irritability, brain fog, and can trigger or worsen depression. The key clues here are if you snore loudly, wake up tired, feel completely unrefreshed from your sleep, or other people tell you that you snore or hold your breath at night. Number 5, medication side effects. Now, this is one many people don't think about, but it's incredibly important. Various prescription drugs can negatively influence your mood, and some are even associated with causing depression. A couple of examples here are beta blockers, which are medications given for blood pressure and certain heart conditions, and corticosteroids, which are medications given for certain inflammatory conditions. It's not always easy to tell whether a medication is causing or contributing to low mood. And of course, you should never stop prescription medication without professional advice. Now, an obvious disclaimer here, this list clearly isn't exhaustive. I've just given you some examples. There are many conditions that can impact your mood. So always speak to a healthcare professional for personal advice that's relevant to you. Here's my key take-home message. To properly diagnose depression or any mental health issue, you always need to consider the whole person. This includes potential physical triggers. And so any mental health assessment should include discussions about lifestyle, medical history, family history, reviewing medications, sometimes a comprehensive physical examination, and sometimes even ordering blood tests to check for common physical conditions, such as thyroid levels, iron status, or hormones. We must never forget that physical and emotional health are completely interlinked. And as professionals, if we're thinking about looking at one, we should always be at least considering the other. So make sure that you as an individual are doing the same when it comes to your health. Now, producing this content takes a huge amount of effort and personal time commitment from me, but as with my previous episodes, there's no advertising and there's no ask. The best way to show your support is to give me some direct feedback here by liking, commenting, subscribing, and even sharing the content that resonates most with you. This way, I'll get important feedback on the kind of content you find the most helpful for the future. Thank you for joining me on The Health Perspective, and I hope to see you in good health on the next episode.